Good morning students. So, today is my last class of nematodes with you. It was many classes were taken on nematodes like intestinal nematodes and tissue nematodes. So, this is my last class with you. Dracunculus medinensis, it is another tissue nematode. So, let us see what is Dracunculus medinensis. If we talk about the geographical distribution, then it is distributed in India, Pakistan, Burma, Saudi Arabia, Iraq, Iran, Africa, West Indies, South America, and it is very worldwide, you can say. And it was once very commonly found in India. In India, the parasite is almost eradicated from Punjab, Rajasthan, Madhya Pradesh, Gujarat, Maharashtra and South India. This parasite has not been found in like Bengal, Assam, Bihar and Orissa. The parasite is mostly found in the western states, and the common name for this is guinea worm. So, if we come to the habitat, here the adult females, these are usually found in the subcutaneous tissues, especially of the legs, arms and backs, in the subcutaneous tissues. Now, if we come to morphology, adult worms, here the males are smaller than the females. Now, the females, they are slender long worms, they measure to 60 centimeter to 1 meter in length with a diameter of 1.5 to 1.7 mm. You can see how big it is, 60 centimeter to 1 meter in length. And the body is cylindrical, smooth and milky white in color. Posterior extremity is tapering and is bent to form a hook. They are viviparous. So, these parasites are also viviparous, that is they doesn't lay eggs, they give birth to larvae directly. They discharges the embryos in successive batches for a period of about 3 weeks, and their body fluid is very toxic and it causes blister formation if it escapes in the tissues. The lifespan of the female worm is about 1 year and the male is 6 months. Now, let us come to the embryos. These embryos are coiled bodies with rounded heads and they are long, slender with tapering tails. They measure 650 to 750 micrometer in length by 17 to 20 micrometer in breadth. They have a very peculiar feature. These embryos are released only when they are submerged in water. That is, only when they get the water medium, then only the embryo is discharged. So, the embryos are set free at the time of parturition when the affected part is submerged in water. This is very important. When the affected part will be submerged in water, only then the gravid females will release the embryos in the water. Now, if we come to the life cycle, the worm passes its life cycle in 2 hosts, the definitive host and the intermediate host. Here the definitive host is the man and the intermediate host are the cyclops. See, in man they harbor the adult parasites in the subcutaneous tissues, and in cyclops the embryos undergo certain developmental changes before they become infective to man. So, the embryo, it undergoes certain developmental changes inside the cyclops. It is the intermediate host. Mesocyclops leucarti, it acts as a host in many parts of the world including India. So, there are many cyclops, but the commonest is Mesocyclops leucarti, and it is also responsible for transmitting the infection in India. So, this is the picture of Mesocyclops leucarti. You can see this is the cyclops. Now, this is the male and this is the female one. See, male is smaller and the females are quite longer. This is the larva. Okay. Now, the development of embryos in cyclops. Each cyclops can ingest about 15 to 20 guinea worm embryos. Remember, the embryos are set free only in water. So, the cyclops are in water, the cyclops are present in water. Their habitat is the ponds and lakes and waters. So, when these embryos are released in the water, these cyclops, they take up the embryos from the water and they can ingest up to 15 to 20 guinea worm embryos at a time. These embryos, then they penetrate the gut wall of the cyclops within 1 to 6 hours of ingestion, and it enters the body cavity of the cyclops, and then after they will undergo metamorphosis and increase in size. So, development starts inside the cyclops. If these embryos are not taken up by the cyclops when they are in the water, these embryos live for a very short period, for about 4 to 5 days. After that, they are destroyed. So, unless taken up by the cyclops, they can live only for a short period of 4 to 5 days. So, these embryos have a short lifespan of 4 to 7 days in water, unless they are taken up by the cyclops. When they are taken up by the cyclops, they are ingested, the cyclops ingest the embryos, then these embryos will penetrate the gut wall within 1 to 6 hours of ingestion, and then it will enter the body cavity, and then it will undergo metamorphosis. It will increase in size. Now, it takes 2 weeks for the development to be completed inside the cyclops, and the infected cyclops usually die at the end of 42 days, but with heavy infection they may die even like in 15 days. So, within these 42 days or these 15 days, man should ingest the cyclops to be infected. Now, entrance into man and development of adult worms. The cyclops containing the infective larva are swallowed by man with raw drinking water. See, the cyclops are present in the ponds and lakes. So, when human beings they consume the raw drinking water, the cyclops enter in the human gut along with the raw drinking water, and in the stomach of the human being, the cyclops are digested by the gastric juice and the larva is liberated. Now, this larva will penetrate through the gut wall of the man, and it will enter the retroperitoneal connective tissues. Here in the retroperitoneal connective tissues, they grow to adult forms, like adult males and females, they will attain the sexual maturity, and then the male will fertilize the female. After the male fertilizes the female dies. The lifespan of the male is about 6 months. So, the male dies after fertilizing the female within 6 months of infection. Now, these gravid females, they will migrate and select its site for discharging the embryos in water. Remember, I said the embryos are released only in water. So, for releasing the embryos in the water, the gravid female worms, they should migrate to such a site where it is easily accessible to water. The site which is easily accessible to water, that is the legs of the washerman's or the hands of the washerman's. So, such sites are chosen by the gravid female worm. So, these gravid females migrate and select its site for discharging the embryos in water. On reaching the skin surface, it secretes a toxin and it produces blister, and this blister will eventually produce an ulcer. Suppose this is the leg of the human being. The gravid female worm they will grow in the retroperitoneal connective tissues. Here they will attain the sexual maturity, then the males will fertilize the females. Now these gravid females, they will travel all along, to reach this site. They will travel all along to reach this site, that is the lower extremities, suppose the feet. Here what they will do, when they will reach this site, they will release a toxin. When they releases this toxin, there will be a blister formation here, and then eventually this blister will turn into ulcer. Now when this man comes in contact with water, that is when he or she goes to a lake, see, he or she goes to a lake or to a pond to fetch water or for washing or bathing or whatever, it is submerged in water. Then what will happen? The gravid female worm, they will come out through this ulcer. And release embryos in water, They will protrude, the gravid female worms, they will protrude their head through this ulcer and they will release the embryos in water. So when in contact with water, it stimulates the worm to protrude its head through the center of the ulcer, and this causes a reflex discharge of milky fluid containing a large number of embryos ejected from the prolapsed uterus. These embryos are back in water for them to be injected by the cyclops. So these embryos are again now in water, again this cyclops will take up these embryos and the cycle continues. This is a picture representing the life cycle. See, the human drinks unfiltered water containing the larva. Now larvas are released in the stomach. The cyclops are digested by the gastric juice and the larva is released. After releasing, they will migrate to the retroperitoneal connective tissues, where they will grow into adult male and female worms, and mating happens, and then the gravid females, they will sorry. Now this fertilized female worm, they migrate to the surface of the skin and causes blisters. They will travel to the surface of the skin and cause as blister. Now when this comes in contact with water, the larvae are released. Comes in contact with water, then larvae are released. Once the larva is released in the water, these are again taken up by the cyclops. And thus the cycle continues. Now if we talk about pathogenicity, infection with Dracunculus medinensis in man is known as guinea worm disease or dracunculosis. The source of infection are the infected cyclops, infective agent are the larva, portal of entry is the digestive tract, site of localization is the subcutaneous tissue, generally of leg. Incubation period, it varies from 8 to 12 months. Now what are the pathogenic effects? Symptoms are manifested during parturition due to liberation of toxic substances. So due to the liberation of the toxic substances, there will be allergic manifestations, then blister formation, and eventually there will be ulcer in that area, right. Now the next thing is septic infections. How this septic infection occurs? See, this is the leg of the human being, this is the ulcer. What I said is the gravid female, they protrude their head through this ulcer and they release the embryos in water. Then again when the person goes to is not in water, their leg is not submerged in water, they are walking around, they are in their home, then what happens? this gravid female again retracts back, they again retracts back. So, when they retracts back, along with it they withdraw infections, they withdraw bacteria. Due to this retracting of the gravid females, as they withdraw the bacteria or infections, they cause septic infections. So, septic infections as a result of contamination by secondary organisms drawn in by the worm at the time of retraction, drawn in at the time of retraction. Now, you have to keep a very broad mind in this regard, septic infection. Now, this patient, as there is a possibility of septic infection, the patient may present with a variety of signs and symptoms. Like the patient may be having septic arthritis, he can have peritonitis. Now, there may be a wide range of infections. So, here this septic infection, it includes a very wide range of signs and symptoms. Now, let us talk about the blister formation in details. These lesions appear whenever the female worms makes an attempt to come to the surface of the body where it can readily discharge its embryos. The common sites are lower extremities. They can also be found in arms, trunks, buttocks, scrotum, head, neck and female breast, such as you see backs of water carriers, arms and legs of washermen, legs of those who fill water in containers in step wells and ponds. So, these are examples of the sites where this blister formation occurs. Prompted by instinct, the gravid female proceeds to her destination where it pierces the skin. The head of the worm tries to come to the surface, leading to itching and burning sensation. So, when the head of the worm will try to come to the surface, it will lead to itching and burning sensation. The irritant secreted by the worm, that is a toxic product, it will produce a small red spot, which will then turn to a bleb or a blister. Then the blister ruptures and forms a small superficial erosion. Now, this small round hole in the center, there is a small round hole in the center through which the head of the worm protrudes whenever the part comes in contact with water. The central hole leads to a tunnel in the subcutaneous tissue where the female worm lies. Person may develop fever, swelling and pain in the area from where the worm comes out. The pain may get worse if the wound develops a secondary bacterial infection. See, this is a blister and eventually it has turned into an ulcer, and you can see from this center of the ulcer, this adult worm is coming out. Now, coming to laboratory diagnosis. Detection of adult worms. This is possible when the female worm appears at the surface of the skin. You can see. Soak the blistered region in container of water daily to coax the worm out. Now, when the worm starts to emerge, begin to gently retract its body, carefully not to break the worm's body. Next, wrap worm around a stick to maintain tension on its body, and then apply topical antibiotics to prevent secondary bacterial infection and cover the wound with clean dressing. So, this is how we can detect the adult worm. So, this is how we can detect the adult worm. Now, next is detection of embryos. The affected part through which the head of the worm is protruding may be bathed with water to encourage the discharge of embryos from the uterus. The milky fluid containing numerous embryos escape, which can be pipetted off and examined under microscope. Then we will find the embryos. Next is intradermal test. Injection of Dracunculus antigen intradermally causes the wheal to appear in the course of 24 hours in positive cases. X-ray examination can be done. Worms in deeper tissues after death may become calcified or absorbed, and the position of the calcified worm can be detected by the help of X-ray examination. Blood examination, you will find eosinophilia. Serological tests like ELISA, IFA test can detect antibodies to Dracunculus medinensis. Next, we come to treatment. Nitrothiazole compound is used, nidazole can be used. A rational method of extracting the worm is to encourage the parasite to discharge its embryos by careful douching with cold water. When the female worm shows herself, the end is tied with a fine silk to a matchstick or a similar object, then rolled inch by inch daily with gentle traction until the whole parasite comes out. So, it is also a diagnostic as well as treatment modality. In diagnosis also we have seen how to detect the adult worms. When the gravid female, they protrude their head through the ulcer, then the head part of the worm is tied with a silk thread, and then it is tied to a stick, and then gradually it is retracted. Gradually they are retracted, and slowly the whole worm can be taken out. It takes about 15 to 20 days. So, it takes a lot of time, about 15 to 20 days for the whole worm to come out. Now, thiabendazole and metronidazole can also be used as treatment. Prophylaxis, the infection can be prevented by breaking the link of the chain man cyclops man as follows. Prevention of pollution of drinking water by infected individual, chemical treatment of water supply for eradication of cyclops, and drinking of filtered or boiled water. Next, let me tell you about something about National Guinea Worm Eradication Program. After implementation of National Guinea Worm Eradication Program by the Ministry of Health and Family Welfare Government of India in 1983-84, the last case of guinea worm disease was reported in 1996, and the disease has been eradicated, and India was declared as guinea worm disease free country by WHO in 2000. So, there was a program like National Guinea Worm Eradication Program, which is a program by the Ministry of Health and Family Welfare Government of India in 1983-84, and the last case was reported in 1996, and WHO has declared India as guinea worm disease free country in 2000. So, let us see a case study. A 28-year-old woman from a small town in southern Sudan represented to a clinic with fever and an intense burning itching sensation in her left foot. The woman stated that she had been living in the slums of Juba for several months, but had never had any health problems until now. Upon examination, a palpable mass was felt below the dorsal surface of her foot. In addition, blood tests revealed that she had high level of eosinophilia. So, she is a resident from a small town in Sudan. She lives in slums. She is presenting with fever, intense itching and burning sensation on her left foot, and on examination we find a palpable mass below the dorsal surface of the foot, and blood test revealed that she had high level of eosinophilia. So, we have so many things to consider, and I think from this case you can easily suspect what she is suffering from. So, your line of treatment and the investigations will be in that direction. She has a palpable mass, she she has burning and itching sensation on her foot and she has fever and she lives in a slum area. So, probably she is collecting water from ponds or lakes, and she also has high blood level of eosinophils. She has eosinophilia. So, this can be a case of Dracunculus medinensis. We have to go for further investigations. We have to already we see a palpable mass, that is it may be a blister formation, eventually it will lead to ulcer formation. Then we have to coax the adult worm to come out of the head of the ulcer by immersing her feet in a water source, and then we can detect the adult worms and also the embryos. So, this was just a case study. I think that is all for today. The important points which you have to remember is, first you have to remember that WHO has declared India a guinea worm disease free country in 2000. Then the intermediate host, which is the cyclops, and the source of source is the drinking water probably. I think we will be discussing about this more in our discussion class. That is all for today. Thank you.